Hello, Vincent Carroll speaking, tutorial number 60, finding the point. Finding a point in acupuncture should be quite a simple thing to do if you believe in the textbooks, for the very simple reason you can measure it in terms of Sung. And of course the beauty of a Sung is it's proportionate to the actual person themselves. So my Sung might be very different than your Sung, and that's very, very helpful when it comes to trying to locate a point. But what I really want to say is that Sung can guide you generally towards a point. It will not find a point for you. You have to do that, and experience comes into play there, plus what the needle itself actually tells you. So therefore, when you're finding a point, say for example, a common one, say stomach 36. If you're finding stomach 36, you know that it is below the condyle on the lateral side, that it is close to the shaft, but you have to get the needle in fairly close to the shaft and under the condyle without hitting bone. If you bring it too near bone, you will hit bone. If you're too far away from where the Sung suggests it is, then you're going to miss. You're going to be away from the channel and you will simply miss the point. So therefore, and all knees differ, because knees differ depending, perhaps a person might have chronic degenerative disease of the knee. A person might have a history of kneeling a lot on their knee. A person might have a history of cold invasion into the knee, or of a lot of use of the knee. All knees vary. Anatomically, knees are different, so therefore the points are different. So therefore you have to find a point, and to measure simply a number of Sung of a tibial tuberosity will only bring you into the vicinity of where the point is. Ultimately, you'll have to find it yourself. And also for a point, a very common point, say like gallbladder 34. I mean, it is distal and superior when you're lying flat to the head of the fibula. But the fibula, the head of the fibula is a bit bigger than you think. I mean, when you're palpating, it's a bit like the iceberg. I mean, a lot of it's hidden below the surface. So therefore, when you're going distal and superior to the head of the fibula, if you're a bit too near, you're going to hit bone. But if you're too far away, you're simply going to miss. So therefore, common sense has to come into play as well. And I use those two different examples for the very simple reason of very different types of points. The stomach 36 point is a point you use generally for deficiency. And if it's deficient, you may not get very much out of the needle when you put the needle in. So you need absolute accuracy. So if a person is completely spleen Qi deficient and you put a needle like stomach 36 in, well, you're going to have to be very, very accurate, because the needle won't give you very much information. At least if a person has some spleen Qi and you just want to top up their spleen Qi, then you will get a propagator sensation down the leg on the stomach channel with gallbladder 34. If there's any form of liver Qi stagnation, you certainly will get a prominent reaction. And the beauty about that is you can afford to give it a slight miss with points where you're needling due to excess, to take the excess out. Usually you have a certain element of latitude. You can manage to sort of maybe miss it slightly, and the Qi will still suck to the needle and be expelled up through the needle. Whereas with a deficiency, of course, that's not so. You're putting something in. So therefore, you have to be much more accurate in doing so. But on an aside, if somebody does complain of a propagator sensation down their leg, be prepared to tell them that this is what you expect, and that it is a Qi reaction, and that it will settle down in about 20-30 seconds, and make sure that it does. Because people may think that you've hit a nerve, and of course you haven't, because if you've hit a nerve, it'll probably get worse and continue on, whereas when it's a Qi point, it'll simply settle down immediately, and people take a lot of, I suppose, relief out of the fact when you tell them that, oh, that's simply Qi, and it's now sort of going up the needle and is draining from the body, because they will understand that, whereas of course a nerve might continue on. So because of that, it's good to explain what you're doing. So, but some points, of course, are away from anatomical landmarks. Say points on the stomach. Say, for example, spleen 15. The textbooks will say it's 4 Sung lateral to the center of the navel. Or is it? Well, it is for many people if you have a fairly flat abdomen. But if your abdomen is emaciated, it'll be dragged in much nearer. And if your abdomen is much more likely bloated due to a liver Qi stagnant in the lower jiao with a hugely bloated abdomen, it'll be much, much more lateral than 4 Sung lateral from the belly button, from the center of the navel. I've often needled at 6 Sung lateral in certain cases. So you have to be prepared to adjust in cases like that. One size never fits all. Anatomically, we're all different, and we have to allow for that, and that's where experience comes in with acupuncture. So the point I'm making is that when you're needling into deficiency, you probably need that greater element of excess, but thankfully most source points, and these are the likely points you use for deficiency, tend to have very well-defined landmarks that are quite narrow in band, so therefore you probably will be able to get them with a greater degree of accuracy. And a lot of points when you're reducing out, they tend to, well, you're able to give it a slight miss because of course the chi will be sucked to the needle. Also in cases of excess, and I find this very interesting, sometimes needles will be expelled. I mean, I've had a number of expulsions out of gallbladder 34. You put the needle in and then it is reflexly expelled, sometimes fully, often in part. If it's in part, you just put it back in again. If it is fully expelled, yes, I simply use a fresh needle and put it in again, and it usually goes in much better the next time round, simply because when it's been expelled, a lot of the excess has been expelled with it. So when you put the needle in again, it's more likely to stay in. And that's just simply the management, the correct management of a point. Spleen 10 often is expelled as well. I often find by tongue, where you needle right side, left side of the nostrils due to perhaps an excess in a sinus, then in that case, that can often be expelled downwards as well. And again, you simply reinsert it in gently and carefully. And I make this sort of observation too, simply because nothing's set in stone, everybody's different. And what you have to do is you have to adjust what you're doing for the individual. If there's a lot of excess, you have to manage that excess by managing your needle. Whereas with deficiency, once you're confident you have the needle in, leave it in for at least half an hour and the chi will slowly regenerate up. When you take needles out, be very careful, of course, that there's no bruise. Bruises, I suppose, they look bad, and some people bruise more than others depending if they're deficient, particularly if they're spleen chi deficient. Certain points bruise all the time nearly, such as Ren 4, large intestine, for yin tang as well. And of course if you do a urinary bladder 1. So be very, very careful. I mean, always apply a little bit of pressure and tell the patient that sometimes a person gets a bruise, that's not unusual, that it will disappear after a few days, as all bruises do. I mean, flag it with them and let them know that it's something that can be expected on occasion and that it's not something to be professionally worried about. Of course, sometimes from a cosmetic point of view, a person doesn't want a yin tang bruise or a urinary bladder 1 bruise, so you might tell them in advance that this can sometimes cause a bruise and they may decline from having that particular point done. But the purpose of this video really is to show that while the measurement of Sung is important, it'll bring you to a point that ultimately it doesn't excuse you finding the actual point. And when your needle goes in searching for the chi, you're on your own. You hope through your skill, experience and knowledge that you're sitting on top of the point or as near to it as possible. And then when you insert the needle, you have to get the needle in to get chi to the needle. It's very easy to pop a needle in more or less in the correct place adjacent to chi, but if that chi doesn't adhere to the needle, or if it's in case of excess, then that chi won't attach to the needle and be expelled through the needle. And if you're trying to tonify, and if your needle is sitting in proximity to the point but not on the point, then you're not going to be able to tonify with that. So that's why we sometimes plunge, lift and twiddle, and the idea is to connect to the chi. But we need to do that, and we need to be aware that we have to do much more than just accurate needle by measurement. We have to use our common sense when we do needle to make sure we actually get to precisely where we want to get the effect that we want. And it's easier to do that when you're expelling, because there's greater opportunity for latitude, because such is the, I suppose, intensity of the chi that needs to be expelled. If you miss by a little bit, the chi will still come to the needle. But with deficiency, you just need to be that extra bit careful to be absolutely certain that you're on the correct point, and that means a knowledge of where your needle's going in. By all means, know the Sung. That'll bring you to the general area, but ultimately to search for it when you do needle. Thank you.